Mm, 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 mm. We're smooth. 98.1 FM has gone 2 minutes past the hour of 9 o'clock. We welcome you straight into Lagos Talks 981. My name is Omatseye Atsenuwa. Now let's get into the conversation this morning as we've got something. Well, it's not money exactly, but it is money at the end of the day because money can't buy it. It's health. Health, they say, is wealth, and that's why we turn our attention to it, even though we know the president at some point in time will be speaking about money, 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 but we'll see how much he would be spending on health for the country or plans to spend for the country in a matter of hours from now. But this morning, our major focus is about safeguarding Nigeria's healthcare system in view of all of the turbulence that that sector of the country has experienced in the recent time, from the professionals in the sector drifting to places where the pay and the pay packet looks fatter, service condition, according in their words, looks rewarding and respectful to them, to systems where people are asking where are the facilities in these hospitals, to even quality. That's what the conversation would be all about this morning. So at some point, would like to hear from you what you experience using the public healthcare system in the country is being like on 01-448-9981. But to set the tone of the conversation this morning, I've been joined by Dr. Adekunle Abiona. Good morning to you.
Good morning. Good morning, my brother. How are you doing?
I'm well, thank you for asking. So we go straight first to speak about, we've seen since the appointment of different ministers in portfolios in the federal cabinet, we're getting to yet to feel sort of the impact of the Minister of Health. Since you are in that sector, maybe you should be able to speak to us and if about the vision so far that the man has come onto the cabinet with, and if you're feeling the impact yet.
Well, in all honesty, um, I haven't felt the impact of these current health minister because in the tone of hitting the ground running, I'm sure most of us, don't even know what he looks like. You get, I mean, it's unfortunate that the the quagmire that the health sector has been thrown into over the years is deepening, and there is no there's no help in sight. That's the truth. Because if there was anything, if their mandates or their promises were anything to go by, or their words were anything to go by, we would have seen at least a bit of action going into some sectors, some part of the health sector. Say, for example, the um, the teaching hospitals. Let's see what the teaching hospital would look like in terms of the administration. Even if you're not even ready to take care of the equipment, let's see what can be done in the administrative level. Shuffle a few things around the national hospital, the teaching hospitals, the federal medical centers. I mean, we haven't seen anything. We haven't seen anything so far, and it's a bit it's a bit disappointing to say the least. Especially the fact that he already has served as a global director for health and nutrition at some point. We haven't even seen any impact on children so far. You know, which I mean, I think there still needs to be there's a lot to be done. There's a lot to be done, really.
Okay, so since even you as a professional who should be having the impact already is wondering what he may look like to the average man on the street, his name is Professor Ali Pate.
Yeah.
So that's just for those asking who the Minister of Health of the country is. Professor Ali Pate is the minister. But again, it's been very quiet at your end, because we remember the health workers, they've been at loggerheads making demands. But for some time now, it's been quiet. Is this saying all is well right now with the workers in the health sector?
All is not well with anybody in Nigeria, that's the truth. But I believe that the people at the helm of affairs in NMA, the nurses and every other health worker, people at the helm of affairs would ordinarily want to give some time to see if there will be some action, if there will be some movement, there will be some. I'm sure there are. I'm sure there's a possibility that there are still ongoing talks with the Minister of Health. Because I mean, I want to believe that they are ongoing talks, because it won't make any sense for there to be a new minister and then you're immediately taking strike actions, asking for increment in pay. I want to believe there are some promises that have been made, and then there are some conversations that are ongoing that might not be private, but I'm just not pleased with, because I believe in talking to people. Let people know what your thoughts. Let people know your actions. Let people feel your impact. Even though we know that, let's probably say there's no budget yet in code. There's no money yet in code. Okay, that's okay. But because there's no money, okay, we know what are the actions you plan to take. Let us know the actions. Let us have a blueprint. Let's know how we can measure your progress over the next 4 years. That's what I believe.
Now, this takes us to the question of people saying Nigerians, most persons don't know where to access the country's health system from. Because you are the professional, you understand the layers of healthcare delivery. We would like you to help us get an understanding of how this system works and how people can begin to access it properly, because oftentimes people say people jump these layers and then just go where they instead of going. So walk us through how it is in the health sector of the country.
Okay, so on the grassroots, there's a primary health care system, which should be the first point of call for every symptom of anything you feel. Primary health care first. Then the primary health care now triages and see that, okay, we've treated you for so and so amount of days, we've not seen any improvement, then we refer you to a general hospital. You get then? The general hospital sees that you need specialist care, and maybe we don't have that specialist in this general hospital, then they refer the person to a teaching hospital. But teaching hospitals usually take care of complications, complicated issues. But unfortunately, Nigerians still need a lot of education as to early presentation to the hospital when your symptoms arise. A typical Nigerian, when he falls sick, the first place he goes to is the pharmacy around him. That's his own primary health care, or the neighbor, who gives him or her concussion to drink. That's usually the first point of call for an average Nigerian. We shouldn't be so. So there's this thing we still want Nigerians to know that there's a primary health center where you should present to first, not the chemist, not your neighbor. That way your case can be nurtured early and then move up. Because by the time you now present to the general hospital or any private hospital, it seems to be complicated already. They can't handle it, so they send it to teaching hospitals, thereby overcrowding the teaching hospital because people don't present early, and then complications are so much. Then they push them from primary care to teaching hospitals straight because they are already complicated. But then the layer is primary healthcare first, general hospital, then the teaching hospitals.
So in essence, when people just move from these areas, they just go straight. So how you find a man with malaria, the next thing you see him at a teaching hospital, do you get to send them back to the to the primary healthcare system because that's where they should go to?
Yeah. So unfortunately, there's a part of the teaching hospital too that has a general outpatient department. That person has unfortunately just overcrowded that hospital and denied somebody a space. You get. So they won't send the person back, but they will actually treat the person, but that person has already clogged up that space for an emergency or for a complicated case, by missing the steps you're supposed to go to first.
And that takes us to manpower. In the recent time, it's been said that your colleagues, thankfully, you are still here. It makes you it makes you a patriot. Probably you maybe at the end of this show probably you have a flight to catch. I won't be surprised, but for now, let's say you are a patriot, you're still here giving service to the fatherland. But the question now is, in the recent years, since professionals are leaving in drove, what impact does this have on the overall healthcare system of the country?
That's a very sad reality, in the past 4 years, or let's say post-COVID, the effects COVID has had on the healthcare of the world at large has been very daunting. It has left a whole lot of backlog in advanced world. And here in Nigeria, it has opened the doors for an exodus, a massive exodus of healthcare professionals, not just doctors, nurses, and the likes. There's been a massive exodus of healthcare professionals, and it has left a huge gap in the teaching hospitals, left a huge gap in the general hospitals, left a huge gap in the primary health centers. In the health system generally, there's now a shortage of manpower so much that some hospitals now employ house officers to come and fill in the gaps. And some hospitals have to use final year medical students to fill in the gaps of house officers just because we don't have many hands on ground anymore. And of course, that goes to show what impact has had on the quality of service that is being delivered. Whatever a final year medical student will do is just probably going to be who's supposed to just be observing, now having to get hands-on. It has to do with a lot more training, and it's pathetic. That's the truth. It's pathetic because we really don't have any more doctors, to say the truth. We really don't have any more doctors as much as we should, actually.
Now, this in itself is scary because if the man is still supposed to be learning from professionals, but now people who should even guide him, they are gone, and then he's saddled with the responsibility instantly to begin to learn on the job. And health is it's risky, isn't that?
It is. Even though they won't give him the very technical things to handle, but it still does. There's still no excuse but they don't have a choice. That's all they have to work with. We won't manufacture doctors from the soil. We have to make do with the final year students who are ready to do something, and every other person wants to get his hand on deck. That's just the sad reality.
Okay, we still got a couple of issues to raise with you when we come back. And for you,
Okay.
if you just joined in, I'm speaking with Dr. Adekunle Abiona this morning, and we're exploring the issues around safeguarding Nigeria's healthcare system. And already you can see we're opening the layers up already in the absence of the professionals seeking better pastures elsewhere. Now it's the duty falls on those left behind and those even still just fresh out of school. That's what so far we've been able to establish, and there is more to come after now. So we'd like to get your call at some point to let's hear what you experience, the experiences has been for you using the public or even the private healthcare system in the country. Would be on 014489981, but that will be after this.
Lifestyle clothes or just simply getting service that is designed just for you. Yeah, we thought you might like all of that at home. That is why we specially created Providence Bank for you to take care of your daily experiences. At Providence Bank, we believe that banking should be all about you and your business and how to get you to the next level. If you do not already have a Providence Bank account, please speak with our business concierge on 0700 77684 or email businessconcierge@providencebank.com to switch to a future forward banking experience. Providence Bank, future forward banking. This is not your typical service of the day. It's the day that puts you at the edge of the seats and the most our Tuesdays are Thursdays and Saturdays are Providence Bank, future forward bank.
We're smooth 98.1 FM. Well, welcome back. And it's still Lagos Talks 981 as we get into the conversation. Dr. Adekunle Abiona, it's a sad one where young doctors are being saddled this very early because of the deficiencies or the shortage in manpower. But again, looking at it, there's been this argument that Nigeria is seeming to be a very cheap ground to train the doctors. So it makes them, it's very easy. So we give them out to the world for free, and they don't even wait to even give service back to a country that has trained them so much to international standard that they just rush out there.
Well, of a truth, it's quite cheap to be trained in Nigeria. I mean, when I was in medical school, that's some 15, 17 years ago, my school fees per year was about 9,000 naira or less per year. So it's quite cheap to train a medical doctor in Nigeria. But unfortunately, after training us, what we need to survive is not handed over to us. I keep saying one of the major skill any professional should have is entrepreneurship and survival skills. You know, if you don't train a man to survive on his own, and if you train him to always depend on the system, I mean, if your system fails, he will attach himself to another system no matter how much you put into him. And that is what just happened. And that's what is currently happening. You know, some of us were able to gather some business skills and pull out and start our own business on our side. And I keep saying that I don't see any Nigerian trained medical doctor that can do as much as he should do given his own potential because he wasn't trained to be a business person. He wasn't trained to stand alone. He's trained to collect salary every month. Let's forget the service is rendering. Nobody's salary is up to what he feels he should collect. Everybody feels my salary is not enough. You get so no matter how much you pay a Nigerian doctor, he might always see that salary is not enough and see the other side as being green. Now move to the other side. At the other side, now I've seen people at the other side even complain to me that things are really, really bad at the other side. But then because they've been fed with some form of incentives, and then looking at where they are currently in Nigeria, seeing that there's no incentive, no hazard allowance is poor, your health insurance is poor, everything is, so they have that mind to just want to go, they just want to do, they just want to leave. So training Nigerian doctors is very cheap. I mean, and we train good doctors. We train very, very sound and seasoned doctors. That's the truth. Because we go out there, we excel. That goes a long way. That goes a long way, you know. But then, of course, once a man can't survive on his own and depends on the system, he will always go for the greater bidder.
I would come back to the issue you raised a while now, where you talked about the survival skill and the need to also get that business acumen skill in addition to being trained as a doctor. I'll get back to it, but I need to, because you raised the question of how proficient Nigerian doctors are, you've also given them credit because you are in the system, there was this recent report where it was said that some foreign trained medical doctors, personnel failed exams when they wrote in Nigeria. What does that say? Doesn't that lend credence to what you were talking about now of the system of training we've got in Nigeria here?
In all honesty, I say one thing. When people ask me, oh, how was medical school? I say, in medical school, we are not told if we pass or fail. The criteria is satisfying the examiner. So you might have all the knowledge in the world, but you not being able to satisfy your examiner will fail you. And satisfying the examiner is not just in your written, your words, your appearance, your carriage. So if you are very sound and you appear proud and pompous to your examiner, he might score you down based on how your appearance is and your carriage and your respect, your manner, your tone. So satisfying the examiner is one thing, passing the exam is another thing. So I saw that article and I smiled. Most of the exam was computer-based exam, and we know how our internet can be here. That's one factor. That could be a factor. That could be a factor. And then you notice that 800 and something number wrote the exam, 403 passed, 433 failed. Also, another factor that could come in is just the way Nigerians write foreign exams and fail. Nigerians write foreign exams and fail too. So foreigners can write our exams too and fail. Sometimes you might not be able to get the ropes of the exams first time. There's usually a system of every exam. There's a pattern at which you set the exam. There are areas where you read around. There are areas where because this is tropical medicine, you are practicing tropical medicine in Nigeria. So if you are trained somewhere in Europe, you might not have a good grip on tropical medicine. So if you write the exam first time, you might not get it right, then later you rewrite it and then you learn a thing or two. Because even during our own internal exams, you write first time, you fail, you down do a receipt. A receipt now, you've gone back to look at your errors. So, I mean, failing exams is not, to me, it's not a big deal. That number is large, no doubt. But I believe if we really want to be objective, then we have to take a poll, and a survey to know each person's challenge during the exam. That might give us a good idea as to how that number is that large.
Thanks for the clarification. So it sits better now, because at first glance, reading through the story, it was like, what is this? But from the explanation, it seemed, well, you made a good case for them already. Yeah. So we'll let that slide for now. But bring it back to your colleagues, and of course, relating to how they treat patients. and the quality of healthcare delivery in the country? It's still because now there's need to get an addition to the check at the end of the month. Well, most of the corporates in this regard will be in the public sector, and where they say they all look for means to have extra consultations elsewhere. So in this case, you mentioned earlier the business ability to survive. So isn't this in itself compromising the health sector when you would spend a medical doctor employed in the public service spare would spend less time or even get to begin to do referrals to his own private clinic?
So I worked in the public sector for about 2 years, but I worked in the private sector for about 14 years. And one hallmark I set a standard for myself and my colleagues is empathy. Empathy and communication. Empathy and communication. And I think the whole health sector in Nigeria lacks that, whether you private or public sector. There's lack of empathy and there's lack of communication. Gone are the days when you just see a patient and you believe you are Lord and Savior over that patient. No, gone are those days. Nowadays, every patient wants to know what the diagnosis is, what your treatment plan is, and what drug you are giving them. By the time you lord over a patient that way, you can't get the best out of that patient. That's the truth. So by the time you are empathetic and you bring the patient down to understanding what the problem is, let the patient know what you want to do, let the patient know the drug you are giving him or her, that puts a high level of confidence in the patient and in you and in the hospital and in the system at large. But unfortunately, to every 12, there's a Judas. There are still elements that unprofessionally handle their patients. Referral of patients away from teaching hospital for your own selfish means is wrong in every standard. When I say business and survival, I do not mean crookedness. I run my own health outfit now, a consulting firm. I still have my patients because of how much good, really competence and character I've built over my 16 years. Okay, so so you can't have a bad attitude and expect that your business will survive. It might only survive for a while to crash at the end. So this business part I'm talking about, this survival skill I'm talking about, does not include being unprofessional in handling or referring patients. That is unethical. As I said, if you build your practice on empathy and communication, and it's time for you to have your own practice or pull out on your own, you will get your patients. They will come and look for you. You will even need to advertise. They will come and look for you because you've built a solid foundation of empathy and communication, which I think every medical personnel should employ. Either you nurse, a doctor, a lab person, you should employ empathy and good communication.
Thank you very much, Dr. Adekunle Abiona. So it's time to get the calls to come in on 014489981. We'd like to know what your experience using a public or a private hospital in the country has been like in terms of quality delivery, service, and satisfaction as what we'd like to get, and as well as you can speak on how we can improve the healthcare service delivery in the country. We'd like the calls on 014489981 to come across. This also gets me back while we wait for the calls. It's also the issue of doctor-patient ratio. For a country, let's use 200 million people, and with the surgeon of professionals out, where does the doctor-patient ratio leave us now? There is a linking question to that, but let's get to that one first.
I mean, the doctor-patient ratio now, you can't even start to put a ratio to it. It's enormous. It's unhealthy. It's unhealthy, and these are little issues that come together to become a monster. That makes a doctor becomes cranky, makes a nurse become a bit unprofessional. When there's so much work to do and you still think you've not done enough, it can make anybody, in fact, any professional can become cranky when it gets to that point. And don't forget,
Dr.
nurses.
Dr. Abiona, don't get cranky right now, but after now, we'd like you to pick up the conversation from here.
All right.
December 1st is World AIDS Day, I think.
Okay.
This man looks like the kind of person so when I conclude with him, I would throw it in to make him know we can get. I think that's first Friday.
Yeah.
So we know so I think I'll speak with him in a bit.
Okay.
And how to get you to the next level. If you do not already have a confidence bank account, please speak with our business concierge on 0700 77 684 387 or email businessconcierge@providusbank.com to switch to a future forward banking experience. Providus Bank, future forward banking. This is from Dola. Listening to Smooth Breakfast.
We're Smooth 98.1 FM. It's gone exactly 29 minutes before it is 10 o'clock. I'm still speaking with Dr. Adekunle Abiona this morning. Safeguarding Nigeria's healthcare delivery system is what it's all about. In addition to getting to hear from you this morning on 01-448-9981. So you promised you wouldn't get cranky. So let's pick the conversation up from there. Doctor-patient ratio.
So, I mean, as I was saying, the amount of patients seeing doctors pre-COVID was already choking the system. Now let's look at an example, at a place where doctors are leaving. In fact, there is a rumor there's a particular teaching hospital that has closed down some wards because of lack of personnel. Doctors have left, nurses have left. So it means we still have over about 50, 60 million people in Lagos, for example. And now look at how many doctors have left. And then because people now live a life of a lot of unhealthiness, people fall sick a lot. Now seeing a lot of sick people, doctors and nurses are reducing. The ones left will actually start blaming themselves for staying. Because when the problem now comes and the load of patients comes on them, they can become cranky. That's the truth. They can, because everybody who is sick can put up an attitude of you must attend to me first. And they know only the doctor can see, only the nurse can see and triage with medical acumen who is sicker than who. And say, okay, this person has a blood pressure of so and so. It's an emergency, but you look like you have malaria, but this person's blood pressure is high. This person can die before you. I pick this person over you, then you become cranky that you came before that person. Because so like that, having to say the same thing over and over and over to patients who won't listen can make you become cranky, and can make you lose your cool, as with anybody who works with crowd, So, but then I'm just trying to say the effect of the pressure now. The pressure is higher. Pressure is more on the people who are actually there working.
Okay, so that leads us to, for every what you call disadvantage, there seems to be like an opportunity. And this is where we get to the private practitioners now in terms of the healthcare delivery system. That ability of people to move and away from public sector, probably seeking better pasture elsewhere outside the shores of Nigeria. Now, the concern again is, as people begin to set up private practices, hospitals around, there is also this thing of the quality delivery, as when you walk into some private hospitals. Honestly, it would be like you're walking into a carpenter's workshop.
No doubt. First thing to note is that setting up a private hospital is business. You're setting up a business. And if you cannot run a business, then you should not have any business set up a private hospital. You're going to fold up in a few days, in a few years. Because it takes a lot to hold it down in the private sector. And you have to also be careful about your staff that you employ. But then, even now, the private hospitals too, they are taking a hit. They're taking a hit because doctors are doctors. Some doctors work in the public hospitals. They close by 2 o'clock or 4 o'clock. Then they go to private hospitals. Most of these doctors have left. Most of them have left. I mean, in my class WhatsApp group, the WhatsApp group of my class, I know how many people still retain their
Is the
plus,
admin
plus
is
two,
the
three,
admin
four.
is the admin of that WhatsApp group of your class medical school still in that WhatsApp group? Be honest with
Yeah,
us.
I mean, they are all sitting down. I mean, WhatsApp is global, but the phone number they are using is the phone of contention.
Okay. All right.
Yeah,
Okay.
I can count how many plus two, three, four are left on that group. You know, I mean, everybody who is a stakeholder in the health sector has felt the impact of this exodus, and that's the truth. Private hospitals maybe might take it a bit more because I've seen some private hospitals fold up because there are no doctors. At least I know two, one on the mainland, one on the island, who are folded up because there are no doctors. And that goes to show the problem. But even the venture capitalists who are investing heavily in private hospital setup now are taking a huge risk and just hoping that one day, because I had a conversation with one of them recently, and he was telling me that he hopes that one day the health sector, the government will look at the health sector and rejuvenate the health sector and make people.
Dr. Abiona, you've got a caller
Yes.
here. Good morning to
Okay.
you. We'd like to know your name and your location. Let's hear you this morning. All right, you're welcome, Chika. So let's get to hear what your experience has been using private or public hospital in the country and how can we get it better?
Yeah, I think it's actually a nice conversation, but like I always said, to what extent are we going to keep having this conversation without improvement? Truth of the matter is that healthcare, as it stands in Nigeria today, has actually become a luxury. For me, I've never had the time. It has always been private. I've not used public hospital before. And it's because a lot of experience that I've actually seen from people, that's why I'm not having it. The truth of the matter is that, do we have shortage of doctors? The answer is yes. The few that we have, are they living? The answer is yes. Is government doing what they need to do to make sure that these guys don't go? The answer is no. We know that global practices that every country is meant to devote, I think, about 18% or 20% of its budget to healthcare per annum. But in Nigeria, what do we have? For the past 8 years, I think we've been doing less than 50%. And with that practice, how do you intend to improve on your health sector? You can't improve. I think it was about 2 months ago or 3 months ago, Dr. Abiona will actually correct me. I think there's a medical doctor that slumped, I think in first service and died as a result of what? He worked for 7 days without taking rest.
Yeah.
So when you see this kind of thing, how do you actually, what motivation do you have from it? I think about 2 years and last year or thereabouts, we're told that hazard allowance of a medical practitioner is about 5,000 naira. And you begin to, what is 5,000 naira for? So for me, when you look at it in and out, there's no encouragement at all. Let me share an experience with you. Last month, a cousin brother of mine had an accident, and then a passers-by, they rushed into a public hospital. We were called, we got to that place. I mean, the doctors and everybody was overwhelmed. At a point, after approach from the doctors, he was like, if we can, let's actually take the boy to another hospital. We were referred to the 2 public hospitals, the 2 general hospitals in Lagos. And I told my other cousin that, let us not gamble this thing, because then it's almost about 11 p.m. at night. At the end, we have to take him to a private hospital where you, lo and behold, we got that he was admitted because the accident was actually very severe. To cut the long story short, he spent about 28 days there. And when he was leaving, was given a bill of about 10.7 million. That is how expensive healthcare has actually come to be in Nigeria. He was actually operated on the train. The cost of the surgery alone was 5 million. At the end of the day, every other thing was about 5.something million. 10.7 million in 28 days. The question you ask yourself is that how many people in Nigeria can actually afford to cover this amount?
All right, Chika.
Can I?
Thank you very much, Chika. Good morning to you. Next call in. Hello, good morning. Good morning. Good morning. How are you today? What's your name and your location? People don't know you, so just tell them your name and location.
I can't hear that person.
Go on.
Yeah, like this is the story of complicity. Our secondary school will always make many things look green, but not all green all the time. I can say that authoritatively. I've been to the Federal Medical Center in Abiona for one or two reasons, and I was more than impressed. I was wow. In Nigeria, at the Federal Medical Center in Abiona, I didn't able to go there. And secondly, an aunt of mine almost lost her life about 4 years ago in an accident that took people for about 3 other passengers. You know, we're thinking of taking us to maybe India or one of these countries to afford. But somehow, somebody recommended we try last to Lagos State University Hospital. And on the medical advice from that person, we consider it today she's alive. Although she's still incorporated in the body, because an accident that normally could have saved her life. So sometimes I believe that some support are beyond human forces. What am I saying there? We may have our health sector, but each sector is even functional in Nigeria. But there are some things that work in Nigeria, albeit at a very minimal level. Yes, things are not even. And that's why we see that many things we tend to do don't really time. In some places, in some sectors, people are working. But the overwhelming majority don't work. And we tend to see those. Where some of our hospitals don't really impose work. Ordinarily, we have primary sector, that means primary dispensaries that will handle small cases. We take them to either a secondary hospital or the tertiary loose and the truth and university hospital. I think they should review our health policy again and again. But that some ailments do not go beyond just your local clinic within your environment. It shouldn't. And when it's beyond that, then you can be part of it.
Okay. Yes. Oh, thank you, Dr. Moses there. So back to you now, Dr. Abiona.
Yes.
So you see where we're now drifting straight on to what you call universal access to healthcare in the country. That's where we're moving to now. And that's what we'd like you to begin to speak to as we are getting ready to wind up this conversation.
Right.
Look at take for example the case Chika. Yes, it's at 10.9 million naira.
Yes.
How many persons can afford that?
Of a truth, my brother, of a truth, healthcare expenses is expensive anywhere in the world. If you want to get that patient out from the sickbed up on his feet, anywhere in the world, it is very, very expensive. There comes now the role of health insurance for citizens, for documented citizens. I'm sure you've had friends or families who have had to travel outside the country, maybe to America or to the UK, and then they fall sick there. They pay through their nose to get themselves back on their feet out there if they don't have travel insurance. You get, so that's how bad it is all over. But then the government must now come up with a concrete health insurance plan, a concrete health insurance plan for the citizenry that can cater for them for all forms of ailments. That's how we intend to move into universal healthcare. That's the only way we can really cover and cater for our own, But then, looking at the current reality, I don't think there are many human beings in Nigeria who can afford to make a deposit of 50,000 naira. Just a hospital deposit of 50,000 naira. I don't think there are not so many Nigerians who can do that.
Dr. Abiona, just stay with me a bit here as we would just get a call or two back after now, 014489981. But it's looking more from what you're saying. Being sick is a luxury that even the poor cannot even afford to take right now. So you have to stay healthy. So we'll be back to close up the conversation.
Just on your dial, just the way you like. That's one thing.
Five loots what shots current. This is
Yeah, they just posted it now. But
so you see that
he mentioned it that he's not sure about it, but they just posted it.
so it makes sense then. It's okay. It's not going out. We're smooth 98.1 FM. It's still Lagos Talks 981, still looking at Nigeria's healthcare delivery system and how to safeguard it. A call is waiting already. Good morning. I would like to know your name and location. Let's get you talking. Lucky from Ijibo, you're welcome. So let's go on.
Private hospitals. Sometimes the doctors, you may not blame them because they find out that if they refer those patients to their private practice, you'll be able to give them the best treatment that they deserve. So sometimes you won't blame them for referring them from the public sector to the private sector. That's one. Then secondly, with the aspect of the jackpot of doctors, we have always had it and will continue to have it. But my problem now is that in 10 years' time, how many of these doctors that are gone, or 10, 20 years, how many of them are going to come back to settle down in Nigeria, to bring that knowledge, that financial power, that whatever they've acquired over there? How many of them are willing to come back? We are not creating that environment to make them be interested to come back. That is my actual problem. We will always have people, doctors going out, but are we preparing to bring them back in? India was not like this before, but they had their people coming back to come and invest in their society. That should also be the long-term focus for us to get the long-term gain of all these problems we're having now.
All right, Lucky, before you go, why do I have a feeling you sound like a doctor? Are you a doctor, a medical doctor? And okay. All right. All right, thank you so much for that, but it seemed related. Thanks so much. Dr. Abiona, just hold on a bit. We'll get this one in for you, this call. Good morning. Good morning to you. What's your name and where you're calling from this morning? Walker, always around the Lekki axis, but let's hear your medical experience in terms of the experience and then what we can do to get it better.
First of all, I would like to thank the doctor that is in the studio that is opening our eyes to some realities about our healthcare and health practices. And the issue of the mass exodus of medical practitioners, I think they are not doing well enough because in the spirit of patriotism, because I think everything should not be about money, money, money. Nigeria has done them a lot of good. I think so. So I think they should be able to give back to the society. If they feel that Nigeria is not doing enough or Nigerian government is not doing enough, I think we were like this when they were being trained, and the same society, the same environment that is not being fair to them, according to them now, is the same society that gave them all that they think they have now. So in the spirit of patriotism, I think they should find a way around sustaining their own services here in Nigeria. On the issue of my experience, I had very funny experiences going to public health facilities. I don't want to mention them, somewhere at Ikeja there. Then I was having pneumonia. So they asked me to run a malaria test, typhoid fever, blood count, and all of that. So at the end, they told me nothing was wrong with me. And I told the doctor, please, I am not feeling fine. Then I didn't know it was pneumonia. The doctor told me to my face that I should excuse him. That him, as the doctor, was telling me that they have run through my system and they knew nothing was wrong with me. He wouldn't mean I knew something was wrong with me. So when I left, then my mom took me to a private hospital. Then the doctor saw me. They took my, what is it called?
Don't worry, just keep going. Just so we're out of time. So just quickly sum up now.
They took my blood pressure, and the man said he's suspecting that pneumonia was worrying me. That what the problem was pneumonia. But now it's time to go for X-ray. So I went for X-ray. The results came out. The man treated me. Within 2 days, I stood on my feet again. So what can be done to better, you understand, the health services? In my opinion, I think we should not only be crying on TV stations and on social media. Nigeria should be able to come out with a plan to hold our leaders accountable. And I think the media should drive this because the narrative has to change. We all accept that government is not doing enough. And rather than complain, the narrative should be, what can we do as a people? Can we come together? How can we put our forces together now? Compare those.
Okay, thank you so much, Walker, for your time and sharing your experience with us. Dr. Adekunle Abiona, we have to sum up the conversation right now.
All right.
Where do we draw the balance? Patriotism, would the doctor, they would say, respond now? Would we take that to the market, to the woman selling Gary, say, give me Gary, take patriotism? But speak to us as we close up now.
Well, we all have responsibilities to make this country work. Either as a doctor, as a nurse, as a pharmacist. But the underlying issue is to whom much is given, much is expected.
So to whom less is given, less is expected?
Oh, of course, yes. If you have less resources given to you, I don't expect you to bring me so much. You can't do more than what you have.
Dr. Abiona, thanks so much. Really do appreciate you. But you look like I'd like to have a conversation with you on Friday, Lagos Talks, because I see December 1st would be the World AIDS Day. Yeah. So it will be a fine place to bring you back again. Let's have another conversation relating to health.
100%, I'm fine.
Thank you so much. Do have yourself a great day.
And you too.
Bye.
Bye-bye.
And that's how we bring the conversation to a close. That's Lagos Talks 981 and Smooth Breakfast, as I'll step aside for Olusegun to come in for Strictly Soul, and then the Smooth Drive will also come later in the day. My name is Omatseye Atsenuwa. Good morning.